Cold sores are usually small sores, or blister-looking patches that are seen on the lips, cheeks, or chin within the nostrils and on the upper part of the mouth or gums. Typically, they cause burning sensation, pain or itching prior to bursting and crusting over. They can be referred to as fever blisters. Herpes virus type 1 (HSV1) seem to be the most familiar cause, even though it can sometimes be caused by the herpes virus type 2 (HSV2). As much as 50 to 80% of persons have suffered from oral herpes in the US, making them have cold sores. Cold sores cannot be cured or prevented, but there are things you can do to reduce how often you experience them, as well as their duration. Some exciting facts of cold sores. Cold sores represent blisters that usually develop near the mouth or on the lips. They are caused by herpes virus strain HSV1 typically. They usually heal between 7 and 10 days in the absence of any treatment. It can be transmitted via direct contact since the virus is contagious. If someone contracts the virus, it stays inactive for a while, but it can be activated by injury and fatigue causes. Cold sores are caused by the famous herpes virus, HSV. Both HSV1 and HSV2 are quite contagious and can be easily transmitted via close contact. Immediately the virus accesses the body, it remains inactive, but a trigger can activate the virus and a sore development will follow. Some people experience it once, while others experience it 2 or 3 times in a year. Some do host the virus without experiencing any outbreak since it remains inactive. Performing oral sex with someone whose genitals is infected by herpes could lead to HSV2 infection. Symptoms. A lot of people do have herpes virus without any symptoms. They can only tell if they are infected when cold sores become visible. Cold sores are usually severe when they initially show up since it's a core infection. Beyond that, cold sores could be regarded as symptoms of HSV1 and 2. That is the only way you can know that the virus resides in that body. In majority of cases, you can hardly notice any other symptom or sign of herpes infection. The symptoms are harsher in young kids since their bodies lack the type of antibodies that can defend it against such an infection. Symptoms may include blisters, lesions, or ulcers, mouth surface or the tongue or mouth pain, difficulty in swallowing, lip swelling, sore throat, increased body temperature, swollen glands, nausea, dehydration, headaches. There could also be an infection of the gums and mouth, known as gingivostomatitis. This stays for up to 1 and 2 weeks, and it doesn't recur. Pharyngotonsillitis is an infection of the tonsils and throat, and it may occur when the primary infection affects adults. The stages. A cold sore will certainly develop in various stages whenever it recurs. That itching, burning or tingling sensation near the mouth could be a possible indication of an outbreak of cold sore. This is immediately followed by sores that are filled with fluid. Swollen glands are equally possible. The sores do appear in a similar spot. Cold sore is accompanied by irritation and pain. Sores break as well as ooze. It heals without leaving any scars behind because of the yellow crust that forms on the sores. In most cases, after 1 or 2 weeks the cold sores disappear. The diagnosis. Anyone who has experienced cold sore before can easily recognize it when it is happening again. Anyone who suspects an infection due to a sore that has lasted longer than necessary can see a health professional. The symptoms are normally clear enough for any doctor to make a diagnosis, but they may equally need a blood test. Occasionally, the doctor might need a fluid sample scraped off from the surface of the cold sore so he can detect the virus presence. That is how it is done for patients whose immune systems are weak, like those who are going through chemotherapy or those who have HIV or even AIDS. Treatments. Normally, cold sore cases are meant to disappear after a week or 2 even without any treatment. Nevertheless, there are antiviral medications that may reduce the duration of the outbreak and reduce the pain and discomfort as well. Antivirals. Antiviral creams for cold sore that are administered over the counter can cut short the life of the recurrent infection. Many creams comprise pencyclovir or acyclovir like Soothalip and Zavirax. They are mostly effective if they are used as soon as the symptoms are witnessed. Applying the cream for as much as 5 times daily in a period of 5 days can help ensure best effect. Creams, however, cannot prevent a reoccurrence in the future. Do you seek antiviral creams? Browse this excellent selection online with plenty of reviews. Oral antiviral medication. Famciclovir, valacyclovir or acyclovir are grouped as oral antiviral medication. They have the capacity of stopping a cold sore appearing when taken at the initial stage. This medication is perfect for someone who is prone to having many outbreaks in a year. They just have to take it everyday treatments to reduce discomfort. They include Blistex, Cymex or Bonjela. They could reduce the discomfort. The above treatments never facilitates the process of healing, but they can be helpful if cold sores become itchy, painful or dry. Apply the creams on sores, don't rub. After that, wash your hands. Those having cold sores ought not to share creams with others. Painkillers. Painkillers like Tylenol or ibuprofen can also reduce the pain. For much younger patients, you can use the liquid form of those drugs. Pregnant women with cold sores ought to see their doctor to discuss a possible treatment option. Patients who have weak immune systems. HIV or even AIDS patients or those going through chemotherapy may experience some complications since their immune system has been compromised. There is a possibility of the infection spreading to other body parts, which includes the eyes, possibly leading to a possible swelling in the brain known as encephalitis. Prescribing antiviral tablets for such patients could be the best bet, or better still, they could see an expert. Treatment options are based on how serious the symptoms are and the medical condition of the patients. Complications. The chances of cold sores causing any complications is non-existent, unless of course, the patient has an immune system that is weak. Possible complications are dehydration. This can happen when the patient is unable to drink anything due to the pains in the mouth. Herpetic whitlow, a possibility of spreading to other body parts, giving rise to finger blisters, etc. Antiviral medications are good enough for this sort of complication. Herpetic keratoconjunctivitis, this is a severe infection that makes the eyes swell and irritated, likely with sores visible on the eyelids. This can be treated with antiviral medication. Cornea may be affected when treatment is not carried out immediately, which could lead to possible loss of sight. Encephalitis, this is when the virus is allowed to spread to the brain, leading to possible brain damage and much worse, death could result. This is highly rare. Patients are injected with antiviral medications via their bloodstream. This treatment is generally effective. Prevention and curbing the spread. With sores visible, the person should avoid skin contact and kissing. Avoid sharing lipstick, towels, lip balm, cutlery, and stuff. Practice hand hygiene. Refrain from touching other body parts, especially areas like the eyes and genitals. Wash your hands with warm water and soap, should you touch the sores at any time.